Views Global Window Hanaji Hotel Saramati de Hinese. Government of India Press Information Bureau PIB Ministry of Information and Broadcasting Kohima Nagaland. One-day media workshop Vartalap on the theme 11 years of Prime Minister Narendra Modi government at Hotel Saramati Dimapur. Aji date 19 July 2025 Saturday dos bajide suru hobole ase aro aji laga chief guest ase Dr. Tinu Chungshi Chang DC Dimapur. Our guest of honor ase Amit Shukla, Lieutenant Colonel, PRO Defense, Nagaland, Manipur and Arunachal. Our Panvi Gupta, Joint Director, HOBIP, North East Zone, Guwahati lagase. IB itu laga one day media workshop Vartalap laga opore amikhan details pra sai sabo.
Very good morning to all of you. I am Pavni Gupta. I am Joint Director in Press Information Bureau North East Zone, and also I am heading the Assam unit of PIB. So I would like to thank all of you for joining us for this Vartalap event today. If my knowledge serves correct, some of you might have participated in our earlier press tours to either Mahakumbh last year or to Maharashtra, Mumbai. Has anybody in the audience participated in that press tours? So apart from the press tour that we undertake to tell media persons from a particular state about what developmental activities are happening in any other state, we undertake this Vartalap event, which is a one-day media workshop, and the idea is to have an informal chat with the media persons about their issues, about what the central government is doing in Nagaland in this case, and if there are any other ways in which we can improve our relationship. And along with that, we've also included an element of a workshop where we try to not do the speeches and have an open discussion about some new elements that are coming up in the media industry. So my session today will be a little bit about fact check, the new tools that are available for fact checking, as well as some of the new sources of news that are coming up and are very relevant, especially to publishers who have their own media portals and media channels. So again, I would repeat, the purpose of this Vartalap is not that we have a news that is run. It is only for your consumption and for your professional development. So today, apart from my session, I warmly welcome the Indian Army, who has very kindly collaborated with us for this Vartalap. We requested them on a very short notice to kindly arrange a medical camp for the journalists. I hope some of you have been able to use the services that have been placed at our disposal by the Indian Army. So I'm grateful for them for doing that. I would also like to warmly welcome Brigadier Bhati, Colonel Shukla, Colonel Venkat Iyer, as well as the DC of Dimapur for taking out their time and spending it with us and with the media fraternity, as well as all the resource persons. So not taking more time, let's start the event, and we are hoping for a true and a energetic event with interchange of ideas and question and answers. So welcome to all of you again. Thank you.
Good morning to you all. Chairperson of this program, Sri K. Sonny Kumar Singh, Assistant Director PIP. Our guest of honors, Lieutenant Colonel Amit Shukla, PRO Defense, Nagaland, Manipur and Arunachal, and also Ma'am Bhavani Gupta, Joint Director PIB North East Zone, Guwahati. My friend, Brigadier J. Bhatia from Intelligence Branch, and his colleagues, the resource person for these programs, our DPRO, and also our media friends and all the participants. Sorry for the inconveniences. I thank our guest of honor for giving me this opportunity. Like to take the program first, because unfortunately today I had 3 programs at same timing. So, but I thought I will attend this one. Another program my ADC is attending on my behalf, but again another important program, symposium on like CCTV installation in Dimapur and Chumukidima. It is been organized by Business Association of Nagas, where DGP is also attending, and we have been requested to attend and share the views. So I'll have to rush down to Chumukidima. That's why I'm taking this program. So I won't be here until during the technical session, but please excuse me. I would like to thank the BIP for organizing this kind of programs, because we know like media fraternities, they are very important for disseminating all these informations of government programs, policies, and I hope that this kind of workshop and this kind of programs will greatly enlighten not only the media fraternities, but through them, through their channels, all the people's public in cities, in rural areas will be benefited. Here I would like to focus is like now it's like 11 years of Prime Minister's government running, and we know many programs have been initiated, many programs have been launched in different departments. Today, I think only from the medical departments, the resource persons are there, but even if we see there are many, in many departments, various programs have been launched, and I think our media friends also, they are well aware of the various programs where we used to organize from village to village, from different colonies to colonies. And I would like to request, taking this advantage, is that you are the channel to share all these programs, to reach out to the people, and also like the positive impact of launching and of all these programs. So I think if we share these positive impacts, and I know personally that there are many people who have benefited and who have done well, but we Nagas, as we see, like many people who have achieved success through certain programs, but they don't come out openly sharing their success stories to the people. But through the medias, if you can share these kind of things, I think people will be really benefited, and through the successful programs of certain individuals and certain organizations or certain societies, the other peoples who are in the rural areas will also be benefited. They will cope up, they will take up the example of that peoples, and I think definitely in longer runs, our Naga society or our people will be economically benefited. So I won't take much time. I wish all the best to all the media fraternities, and also invite this on the success of this program. Thank you once again.
At the outset, I thank Mr. A. Kumar Singh, the Assistant Director, PIB Kohima, for giving me this unique opportunity. I am the PRO and spokesperson, Ministry of Defence for Manipur, Nagaland and Southern Arunachal Pradesh. In 2025, we had stepped into a new era filled with the promise and potential. I am pleased to share the significant developments of the Ministry of Defence that I so humbly represent today, and has also been resonated by our Honorable Raksha Mantri in various national and international forums. As you are well aware that assessing the reforms is a dynamic process, and it reflects our progressive philosophy and approach towards self-reliance. Thus, the current year has been unanimously declared as the year of reforms by the Ministry of Defence. This year marks a transformative phase aimed at our evolving armed forces into a technologically advanced, combat-ready force, prepared for integrated, multi-domain operations. Several key areas are being focused upon for this reform journey. The enhancement of jointness and integration among the defense forces is paving path for establishment of the integrated theatre commands. Attention is also being directed towards emerging domains such as cyber and space and technologies like artificial intelligence, machine learning, hypersonic and robotics. Inter-service cooperation and joint training is helping us build shared operational understanding. The acquisition procedures are also being simplified, making it time-sensitive and more effective. The public-private partnerships are being encouraged through knowledge sharing, ease of doing business, and collaboration across all stakeholders in the defense ecosystem. Civil-military coordination is further strengthened to reduce inefficiencies. Our aim is to position India as a credible defense exporter through the R&D and international collaborations, while also focusing on veteran welfare and leveraging their valuable expertise. Above all, we strive to instill pride in our rich Indian heritage while adopting global best practices suited to our national context. We are confident that this year of reforms will be a milestone in our defense modernization journey, laying a strong foundation for securing India's sovereignty and an ever-evolving world. In the state of Nagaland, the commitment of our defense forces has been a beacon guiding us, ensuring the peace and stability in the region by means of coordinated efforts. Though the safety of citizens remain our key responsibility, numerous humanitarian assistance and disaster relief operations have also been undertaken by our forces in coordination with the state administration. The admission process briefly starts centrally for all the schools in the month of either September or October every year. And after clearing the All India Sainik School entrance exam, some counseling sessions and medical examinations, the students are granted admission in class 6th and 9th, strictly on the merit basis. Presently, 494 cadets are enrolled with the school, and as mark of achievement, in a short span of time, 9 cadets of the Sainik School have commissioned as officers in different arts. Ladies and gentlemen, the Indian Defence Forces stand as a shining pillar of strength, dedication and innovation, committed not only to safeguarding our borders, but also to advancing the strategic vision of Atmanirbhar Bharat and Viksit Bharat 2047. From the strategic national reforms to the regional outreach, every initiative reflects a deep-rooted resolve to build a self-reliant, empowered and secure India. Whether it is fostering indigenous defense production, strengthening local recruitment and training, or promoting innovation in emerging domains, our armed forces are aligned their mission with the transformative vision. But this journey cannot be traveled alone. The media plays an equally crucial role as a bridge between the forces and the people, as a platform to amplify success stories, and as a powerful tool to inspire trust, transparency and public awareness. Together, with courage in our heart, clarity in our goals, and unity in our purpose, we will march ahead towards a stronger, self-reliant and developed India. Thank you very much for your time. Have a good day. Jai Hind.
Today we are going to talk a little bit about PIB. Although we have a very good office of PIB Kohima here, but still I'd like to tell you a little bit more about what exactly is the mandate of PIB. आप बताइएगा कि वो जो mandate है, is it being fulfilled by our PIB Kohima office? And after that we're going to talk about, dwell a little bit about the subject of misinformation, disinformation and what the government is doing as far as fact check is concerned, and maybe what the media fraternity can also do for that. And finally, we are going to talk a little bit about one new source of news that has come up by Prasar Bharati, which is the PB Shab platform. So, this is specially useful for the digital media portals that are there who are not either on print or on the electronic TV wavelength, but are there on social media or have a website of their own. So we'll start with the first slide. So basically, PIB is the authorized media agency nodal organization of the Government of India, the Union Government, to act as a facilitator between the government and the media. So if the government wants to tell anything to the media, it happens through PIB. Or even if the media has some kind of a feedback to give to the government, that also happens through PIB. And also we are tasked with analyzing the public sentiment as reflected by the media to the government. So if it requires any kind of immediate short-term policy changes, or even in the medium term or long term, that gets reflected to the policy makers in Delhi through the PIB office. Next slide please. So as I mentioned, the nodal agency of the government, it provides feedback to the government of people's reaction and how do we communicate to you about what the government is saying. We issue press releases, we issue press notes when some union minister is visiting from Delhi to Nagaland. We facilitate that interaction with the minister and other senior officers of that particular ministry with the media. We also provide high quality free to use photographs, and we are also trying to delve into the domain of videos, especially for the use of TV channels and digital portals. And of course we have a very vibrant social media platforms of all PIB offices all across the India as well as the PIB headquarters. So right now information to media on PIB is available in English, Hindi, Urdu and a lot of regional languages also. So we'll come to the languages that are available in the Northeast and what we can do for Kohima, Nagaland particularly. And of course we organize press conferences. Secondly, we do this. So this Vartalap, and the second element is the press tour. So I met two of people from your fraternity who had gone to the press tour to Maharashtra last year. So we do that also. Next slide. Okay, so how do we do it? So we have a PIB's website, pib.gov.in. So if I ask you, when was the last time the Prime Minister visited Nagaland, and whether you want some information, you want to refer to that information, कि PM कब आए थे, what did he say when he visited, if you want high quality images of that visit, free to use, then how can you use that on the PIB website? So you just log on to PIB, and as you can see, this was the PM's visit when he visited the Hornbill Festival in 2014. So right now, PR's press releases as far back as even 1950s is available on the PIB website. But from 2007 onwards, in very high quality digital version, this is available. So you can see the entire text of the Prime Minister's speech that he gave in 2014 is available on the PIB website. So you can log in and it is free to use. If you want a demonstration of how to access this, we can arrange that. Also, either right now or post this event, we can do it on a one-on-one basis. Similarly, use of high quality images next. So this again is right now on the PIB website. You can see all the images of the Prime Minister, and this is just an example. We have press releases and high quality images of all union ministers visiting different states. So I'm using this just as an example. So again we have high quality images that can be used by the media, free to use. Next. Okay, so the fact check unit of PIB was started in November 2019, and to just give you a little bit of data, since 2020, April of 2020 till June of 2025, around over 2.5 lakh queries have been received by PIB fact check on fake news that is circulating related to the central government on different social media platforms. Specifically for Operation Sindoor, which you would have heard of, I'm sure, within 4 days the fact check unit received 25,000 queries, and they issued 75 posts debunking fake news that was going around Operation Sindoor in the country. Next. So I asked some people, I was in Bokajan yesterday, so I asked some of the press people there, did you hear about this news that Ajit Doval has said that please everybody be ready, we are going to engage emergency provisions, a big attack is going to happen in India, please be prepared. Was this circulating in Nagaland, any idea? Okay, so away from fake news on that, but I was surprised to know that even as far away as Bokajan, this news was circulating well amongst Assam media also. So, so if you can see this, is this screenshot visible, what I have put? So this is from Ajit Doval's handle, and you'd be surprised to know that Ajit Doval does not have any official social media handles at all. But this looks genuine enough to be circulating on WhatsApp. So PIB at that time was debunking such kind of fake news and several related to Operation Sindoor. Again, I just use this as an example. Next slide. Okay, so back in 2023, we got a call from Northeastern Council that there are 2-3 pamphlets that are going around on social media, and they've received queries from potential beneficiaries that NEC is providing free of cost tuition and sponsoring hospitality, hotel industry and nursing courses in Japan. So this pamphlet was going around on social media at that time, and they got in touch with us and listen, this is not right, and people are are asking us what is the exact situation. So we in October 2023 we issued a fact check on that, and if nothing else, if it doesn't reach the right person, at least if somebody who's searching whether this information is true or not, they're getting it from a proper source, official source that listen, this information is not correct. Of course, if the media comes across such information and they want to check from PIB fact check, they can also issue a small story on its behalf that see, this is going around in Nagaland and please beware, and people should not get carried away by such fake news. Next. Okay, so this particular example is of Assam actually, but still I thought that this is relevant enough to be shared with the media here. March 23, 2024, the director of Kaziranga National Park called us that there is a fake news that is going around that one rhino has been killed by poachers in Kaziranga. And it was a very important year for Kaziranga National Park because the year before that was declared as a zero poaching year. Internationally, it was recognized that Kaziranga has been able to arrest poaching, and it was celebrated. So this came at a time when this was being celebrated and this fake news was going around. This is one news that was there by India Today Northeast. It is still there. Just this screenshot is not old. This information still exists on the website, internet. Next. This also was there by Deccan Chronicle. This also has been removed now, but this was also put on the internet by Deccan Chronicle. That rhino found with dead horn removed, but if you closely see, the image used of the rhino is of a African rhino. It's a double horned rhino, not the Assamese, जो हमारा Indian one horned rhino नहीं है. So again we can discuss कि वो कितना बड़ा issue है, but in terms of when we go into the media ethics, such things should be taken care of eventually. Next. So we took out a fact check. So we got the information from the forest department that this was a natural cause of death due to infighting amongst two rhinos. So there was no poaching involved. So we took out this press release, and a lot of, apart from a few, a lot of media updated their news. They ran it that okay, the information that we had shared was wrong and it was actually not poaching. So again, one example of how the government is having to deal with such cases of fact check even at a very subdivisional local level. Next. Can we play this? So, abhi play mat karna. So this particular post is of 16th June 2023, 2 years back, and AI has developed its potential manifold. the quality of photographs, AI generated photographs and deepfakes videos that is now available free to use by anyone who can use a computer is just mind-boggling. So I'm just showing you this particular video that was fact-checked by PIB in 2 years back.
Years of Prime Minister Narendra Modi government, we are fortunate to be selected as the department in your very important program. Before we start my speech, I want to introduce ourselves because everyone must be wondering who are from where we have come. So myself, I'm the Joint Director, State Program Officers, RMNCAH, that is Maternal, Neonatal, Child, Adolescent Nutrition, Reproductive Health, and also in charge of ART, that is Assisted Reproductive Technology, Surrogacy program in the department. And I have with me Dr. Thomas. Dr. Thomas, please stand up. He's the Deputy Director. He has lots of assignments. He's in charge of planning and also the IEC in the Directorate, besides his many assignments that are two important programs. Then we have Mrs. Amongla Iyer. Please stand up. She's in charge of PMJAY, Operation Manager. One of our friends, Dr. Bendangtula, Deputy Director Ayush, is unable to be with us because she has gone for a national workshop in Delhi. So 3 of us are here. I'll be, for today's program, we have, under Health Department, we have more than 30-40 schemes under the Prime Minister. But we have chosen a very few topics which are very close to the Prime Minister and which are very relevant today. So I'll be saying a few words on those programs, but in the next session, interaction session, my friends will be helping me, and you are always welcome to ask anything that you want to know from our department. So today it is both a privilege and a responsibility to stand before you today to speak about a transformation that touches every household, every village and every patient, Ayushman Bharat, and the strides we have taken in Nagaland towards universal, equitable and digital health. In 2018, the Indian government launched Ayushman Bharat, comprising 2 landmark initiatives that have transformed the healthcare landscape in India. The first one is Pradhan Mantri Jan Arogya Yojana, PMJY, and the second one is Health and Wellness Centers. So to talk about the first one, the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana is a flagship centrally sponsored scheme that provides health insurance coverage of ₹5 lakh per family per year for secondary and tertiary care hospitalizations. PMJY became the world's most extensive government-funded health insurance system. For the rural family who had previously avoided hospitals, due to prohibitive cost, PMJY became the affordable safety net. The scheme is fully funded by the government with the cost of implementation shared between the central and the state governments. Our state has got national awards also under this program during the last 1-2 years. The key features and benefits of this program is, number 1, health coverage, ₹5 lakh per family per year for secondary and tertiary care. Number 2, cashless services, available at empaneled hospitals across Nagaland and India, direct reimbursement to hospitals. Number 3, easy access, paperless registration at hospitals and designated centers. The impact in the last 1 year, 3-fold increase in authorized procedures since launch, 65% rise in public hospital revenues. The scheme targets 3,96,2 2 households as per the census of 2011 data, which include 2,44,898 PMJY households, 12,333 missing middle, and the government employees and pensioner households is 97,125. The challenges we face under this PMJY is number 1, low Aadhaar saturation. Many of our rural population does not have Aadhaar with them. Number 2 is poor internet connectivity, especially in the very hard to reach areas and remote locations.
In general, but like say for example someone like Ravish Kumar, he has always been critical of any establishment. The government might not be happy with him or hundreds of people like him, but he is not in a very traditional media right now. He's out of any TV or anybody. They may have very critical things to say about the government, as the 4th Pillar Article 19 safeguards his article, freedom of expression. So for maybe sometimes for some reason the government might not approve his accreditation by DIPR of his place or the government mechanisms. Does that mean, as he said, platforms like him might not have access to certain closed spaces where government organizes very structured thing in which only very like the traditional media are allowed. Even in Nagaland, there are sometimes events and programs in which only the traditional media are allowed, and critical voices might be sidelined. So that is our concern.
So, my understanding is that what you are saying is that digital media is the only critical voice, and that there is no criticism happening from the print and the TV channels. Which, if they have accreditation, are you saying they are not allowed during whatever events are happening?
No, there is critical voices in the division, but there is a growing number of critical voices also in the newly emerging platforms.
No, that's fine. But the critical voices in the traditional media, they are allowed access. They have accreditation and they are allowed access. So this is my understanding that probably 2 issues have been mixed here. One, you are saying is that access to only critical voices is not being given. But that is, when I asked you, that is not true. The critical voices in traditional media, they are being provided access. And coming back to my answer to what the previous journalist asked, even the central government, the state government, they are devising mechanisms on how to give some kind of recognition to the digital media also. So it's not about criticism per se, it is about developing a mechanism in which digital media can be identified. There is still, let me ask you a question, is there a body that within the media that governs these digital media people? Is there a body within the media where all of the digital media platforms are registered? For example, in case of Press Council of India, in case of print, there is Press Council of India. In terms of your TV channels, there are a lot of self-regulating bodies. I think there's the National Association of Broadcasters, something like this. I'm forgetting the exact name. So this is an ongoing thing. It has nothing to do with being critical or non-critical. All kinds of media, at least in the traditional domain, are given access to all kinds of government events. Standalone, maybe accreditation is not given, but very established digital media channels are being given separate passes for individual events. So their access is not revoked as far as central government is concerned. Even in Guwahati, we allow all kinds of media, anybody to come in for our events as long as it is not a security concern.
I think this is the last question for Pavni ma'am because we are running out of time. Thank you very much. And now we expect some questions. There are so many good schemes, programs Madam has mentioned. So now it is your time to ask questions to Madam and to the Department of Director of Health and Family Welfare. Please, anybody?
We would like to know about the CMHI scheme and the empanelment of hospitals. So there is a lot of confusion.
Hello. So PMJY and CMHIS, you must have already heard, most of the private hospitals in Nagaland, they terminated the contract on April 17th because of non-payment of claims by the previous insurance company, which was Future Generali Insurance Company. However, after that, Future Generali's insurance contract ended on 31st of March 2025. After that, we ran it on Transmart for 1 month, and now we have a new insurance company, Reliance General India Insurance Company. Now, with the new insurance company, most of the private hospitals, they have submitted their letter of intent to empanel again under the scheme. So currently, we have already signed the MOU with CIHSR, Olive Hospital, Bethel, and Eden Hospital, private hospitals. We are hoping to get the MOU signed with Faith and Nikos Hospital in the coming week. So that is for private hospitals. Apart from the private hospitals, this is just to let you know that all the public hospitals continue to function without any interruption. And also any private hospital or public hospital empaneled outside the state continue to function without any interruption. So these cases were only for the 16 or 17 private hospitals in Nagaland who had terminated the contract. Again, after they submit the letter of intent, because there were certain allegations of fraud from the insurance company also, we are vetting all the applications very carefully. We will not be empaneling any hospital that does not have a valid registration certificate with the government of Nagaland, and we will be checking every single detail that they are submitting, including their doctors' details, their medical professionals' details. So what Madam had said earlier about ABDM, the HPRs and HFRs, we will be empaneling only those hospitals which has already registered for the HFR and they have valid HPRs for their doctors. So we are also taking additional steps on our side before we empanel these hospitals back again, ensuring that we don't have similar issues that we had with FGI earlier. So just to update you, the private hospitals, we already have CIHSR, Olive, Bethel, and Eden back on board.
So next question, please.
Yeah, one more.
Yeah.
What mechanism has the government or the state health society put in place to ensure to prevent fraud, especially with the insurance scheme, medical insurance scheme?
So to prevent,
What's the primary reason
Yes,
for
yes.
insurance generalists? What's the name?
Future Generali, right? They had alleged fraud, but it is not proven yet. So they have given a statement that they will clear all the payments. The court has also taken this up, and then only if at all there is investigation to be done on the fraud, and recovery will be done after that. But in the meanwhile, what I had just mentioned earlier, we are also ensuring that every hospital has HFR, which is the Health Facility Registration under APDM. We are also checking that every doctor that they are claiming for during empanelment has an HPR, which is the Health Professional Registry registration. So that the HPR is issued only after the respective medical council vets their application and they show it as a genuine doctor. Then only the HPR is issued. So we are empaneling only those hospitals whose doctors already have a valid HPR. So we will not be allowing any hospital which does not have an HFR or HPR. That is one thing. On the other thing, with the new insurance company RGI, we also have a clause that they will be deploying whatever possible latest technology, including AI/ML, to detect fraud beforehand, not at the end of the policy. So it will be an ongoing process. So they have been showing us some demonstration of their AI/ML capabilities also to detect fraud on the go. That is a second thing. And on the third side, we are also in the process of getting a third-party audit agency. So before the fraud happens, we will also be having our own third-party agency who will be checking all the claims before the fraud happens. Those are the things that we are currently undertaking.
I think I have side one situation.
Yeah.
Hypothetical. Okay, imagine I'm a civilian and you are a doctor, right? And you happen to work in one independent hospital. And we both happen to know each other.
Yes.
So I'll come up with a proposal. I'll act as a patient, someone who is ailing, I'll come to you, and then you draw up, say, you make up a medical condition for me. You say it's coming from so disease or illness, and then you write up the prescription and you put it up for, I think it's you put it up, the doctors put it up for this, but it goes through a very process like this. So how do you stop, say?
So let's say appendectomy, right? So you have an appendectomy and you are claiming that you have an appendicitis and you have an appendectomy, right? So during the claim processing, any insurance company, they will ask for the diagnosis, right? So they will ask for an ultrasound to check whether you really have the appendicitis or not. So all these diagnostic reports, the insurance company will ask for these documents. Now again, you might say that there can be collusion between the doctor, the patient, and also a diagnostic lab also. So we are using the NHS portal where, they have this AI system that can detect if certain documents are being used again and again. For example, a USG for appendectomy from somewhere, if it is uploaded again and again, the system detects that, okay, this image has already been uploaded somewhere else also. So those things are already in place. Again, fraud is an ongoing thing, and I think anywhere in the world you will not be able to prevent 100% of fraud. But we are also trying to put in place all this technology, as well as our own third-party agency. The insurance company has also their own audit team also, who are going to all the hospitals. Just last week we have issued an authorization letter to our insurance partner for the hospitals to allow them to come and audit all their claims. So we are trying to monitor much more closely also all the hospitals, the claims beneficiaries, to try and prevent the fraud and allegations of fraud that happened in the previous policy year.
It's regarding the PMJ. Right now, as we speak, there are certain hospitals. I wouldn't name them. We have talked to certain people. Certain hospitals are displaying these big billboards which say that we are a PMJOY empaneled hospital. The thing is, confusion is a lot of patients who may be poor people, they go in seeing these billboards and they think Ayushman card will be accepted. They go in and then all the hospital procedures are done. Then try to make the payment, 40,000, 50,000 rupees bill, and they don't accept it. But outside, they get into the hospital just because the billboard says we are Ayushman accepting hospital and all these things. So it's causing problems to local people.
So are you talking about hospitals within Nagaland or outside Nagaland? Within Nagaland, right? So again, we have been running press releases also asking beneficiaries to only go to public hospitals until we get the private hospitals on board. So we have a social media handle also where we have run posters telling beneficiaries that as of now, private hospitals have terminated the contract. Please go to only the public hospitals for now until we get them on board. In the meanwhile, we have been also working on updating our memorandum of understanding, contract terms and conditions. So in the meanwhile, if there are certain hospitals, if you can please name it to us that this hospital is no longer empaneled but they are still showing as empaneled, then we can take action on them. Otherwise, unless we have the specific names, we may not be able to immediately take action. However, we are also trying to get all the private hospitals back on board as long as they meet all the criteria for empanelment.
Yes, next question please. Anybody from the middle?
The 2 weeks public hospitals in Nagaland will be Dimapur and Kohima. We find in India, we keep hearing about theft happening here, and just recently also Kohima, I think big amount of staff have been stolen there. Has the department increased the security on that, or what's the latest update right now on the two hospitals, theft in the two hospitals?
I think Sar's done now.
I think maybe the question is out of the purview of this Vartalap, I think, but yeah. No, security-wise, I think not only here, even if it's outside in other medical colleges also, or any other set, I think it's not the purview of the department to increase the security. The only thing that we can do is we write to the appropriate authority to provide for it. But those details, I think, I cannot give you the details right now how the communication has happened. I think some other are looking into it, but the awareness among the staffs, I think this is a continuing. I think the meetings within the health societies, the committees is continuing, but to provide physical security to the hospitals, I think the appropriate authority has to help us. So so that is it. I think I may not be able to satisfy you on that, but I think basing on the discussions which we just had now, I think if you look at the issues or programs which is happening in Nagaland or across the state, besides the investigative journalism which you are doing, and then I think for us also we're coming to aware about it. If you look at many of the programs, a big chunk of the success of the programs depends on sensitization, and that is one issue. Our programs are also, I think, some we face problems. For example, very common thing, the immunization, the polio. We had lots of, in the villages, we had lots of issues from the community. It's just because of the understanding only. Because of, so I think taking this platform, I think I would like to request all of you also, when the new programs comes, or even like the PMJY, SAMHS also, we need a lot of support. We are collaborating with other agencies also to help us in certain pockets for the sensitization of this. So if we can maybe go in depth about these programs and then help the department also in sensitization this, I think it will be a great help to all of us.
Next question, please.
From what we have been talking about, but it's for the medical friends. In Dimapur and Kohima, we know that the pollution level is very high. And yesterday I happened to have an interaction with a scientist from Pollution Control Board, and we were just talking about how it is important to create awareness, the health aspect, the effect on the health the pollution has. And especially we see a lot of young children who are having complications with their lungs, breathing, you know. And when we come to Dimapur and Kohima, we always have this issue of constant dizziness, headache, irritation, eye irritation, and all these things are related to pollution, because when we go out, we feel that it's much, our body feels better, and the air is much breathable in that sense. So I would like to know if the health department is dedicating any particular research or studies on the pollution in Kohima and Dimapur, and if so, we would be happy to highlight it for the for our public in that sense. Thank you.
So when we come to pollution, I think, for example, especially for us, we focus mostly on the biomedical waste issues, which the pollution through the biomedical waste. We are at a very nascent stage now. I think we, compared to other states, I think the biggest problem with us is we don't have a common biomedical waste facility where we dispose many of the body parts and other toxic materials. So that is one issue which we are facing. The department is also contemplating ways and means to bring about that. Coming to I think when we talk about the pollution, the general pollution on the dust and all these things, so as I said earlier, these are, for example, maybe this will be linked to the respiratory tract infections and all those things. So different programs, they have their pamphlets. So as we were discussing this morning, if we had known about this a bit earlier, we could have maybe come prepared and maybe give the leaflets to all of you also. So those programs are already there. But as I said earlier, we need support, especially from the village communities, leaders, and especially our media fraternity to take forward this message. These are ongoing issues which are being discussed as Madam has said earlier, in the village health days. But sometimes talking about this from just one angle, people are not very receptive also. So I think if it comes from different angles also, I think it will be good. So the issues which are brought out are very legit. It is there in our leaflets and IEC materials and all. But we need to amplify those things. Yeah.
You want to share? So, please.
I think it will be a great privilege because we have 3 doctors from the medical department. So I wanted to ask you one question. This is about Japanese encephalitis, which is getting very common, and then we have heard that there are 2 death reports here in Chumugirima in Dimapur. So how serious is the medical department and the government of Nagaland regarding that?
Thank you for the question. Actually, the department has issued many notifications, I think, already in the media. And this Japanese encephalitis, we have some districts who have not taken the vaccination because it was not their earlier days. Districts like Peren, Mon and Pek, they have not been given Japanese encephalitis vaccination to the children, but these are the districts where Japanese encephalitis vaccines has taken already. But we all know that this, in spite of the vaccination status, the host is the pigs, right? And through the mosquitoes. So the Department of this one National Vector-Borne Disease Program, they are trying their best to go and survey, and they are already working at all those where there are these Japanese encephalitis cases, and the department is already working on it. Just recently, our mission director, they just came back from the national level yesterday. They had a talk on this also. They wanted to include Japanese encephalitis vaccination to every district in the state, but that it has to be done only after a technical, only after we get the signal from the technical survey by the national level only. We cannot just take up like that. So that is also on the pipeline. So the department is trying its best. The CMOs of Chumugirima and Dimapur, they have activated the district task force, and they are already working into it, and we believe the cases will be reduced and it can be controlled. That much I can say.
So I would like to take this opportunity to please share with you our social media handle as well as our toll-free number. Because in Nagaland we don't have much of TV reach also, and radio also we don't have much penetration. We are trying to reach out through our social media handle, but again the views are still very less for us. So if you can please help us in getting this out. This is the QR code to our social media handle, and that is our toll-free number for any help that any beneficiaries require for assistance, specifically for PMJY and CMHIS. Yeah. Thank you.
and Srimati Alomla Iyer, PMJY Operation Manager, Directorate of Health and Family Welfare, Nagaland, for coming and giving a very, very useful and beneficial insight into the working of the and the activities of the Health Department in Nagaland. Thank you very much for coming to our program and making it a grand success. And last but not the least, I would like to thank all the friends from media for coming and cooperating with us, and especially the Dimapur Press Club, and also the Indian Army and all the doctors and personnel who have come here and attended to this program, and all the staff of PIB in the Central Bureau of Communication, Ministry of Information and Broadcasting, Government of India, for making this program a grand success. Thank you all, thank you very much. Now with this we end the program. Thank you.
So viewers, aji laga one day media workshop Vartalap laga opor apni khan bi dikhi paise. Aji laga chief guest thagishi Dr. Tinu Chungshicang laido Dimapur DC thagishi. Tai rabi koise ki media khan bishi important ekta role khile. Dur jaga de news punchiu na thaga jaga de do media khan bra punchai digine benefits bi bishi pawo ko ini bi janai diche. Aro Indian Army Ranga Pahar military station Dimapur khan bra bi special medical free checkup bi dishe ami khan media khan karne. Aro ide laga session duita thagishe. Second session to bishi important aro bishi interactive session thagishe do technical session thagishe do Panvi Gupta taido Deputy Director Head of Office North East PIP North East Zone Guwahati laga ase. On the topic PIP fact check and related issue laga opore tai bra ami han ge second session te tai luise tai koishi ki media to bishi important role ekta ase holi bi ajegeli technology bishi high hoigina ase bishi demand bi hoigina ase etu laga opore AI jada amde AI bra bi ami han bishi fake news khan bi ulai nohele bi misa misi news khan bishi bi deliver kurigine ase koine ase to ne apni khan news to hosa asa na koine apni khan jani ule ase ule to PIP laga .government.in de jaine tu laga central website te jaine details pra jankari do apni khan lobo pare ko ini bi janai dia ase aro itu ikla no hoigine medical department of Nagaland khan bi ahi gine ame han ge health laga issue dibi opor bi kotha koise aro itu ikla no hoigine medias aro ide laga resource person khan bi interaction session bi thagishe aro tu laga opor ami khan media laga opor ase guli bi noili bi health issue laga ase opore ase guli bi ami khan bal bra jankari loigini bi thagishe aro twikla noigine ami khan Dimapur de noili bi Nagaland de private hospital khan de bi impanel kurini thagishe health card laga opore holi bi few months back itu laga opore bi tahan cancel kurine health card khan PMJSY khan nachulaine thagishe holi bi de company nutun lode tahan tie up kurine ase use aro tu laga company to Reliance General Insurance Company koine ase aro ite do jundu jaga de private hospitals khan ase gole do CIHSR aro Eden Hospital noili bi Olive noili bi Battle Hospital de available ase ko ini bi tahan bar jankari dishe ajigane manase. For more news and update, keep watching Global Window. This is your reporter Yaungamla with my camera person Anongai Jamir reporting from Hotel Saramati, Dimapur.
It starts with a single shot. In just 10 days, turn your passion into a profession. Master the art of coffee, from bean to cup. Seats are limited. Start your barista journey today.